Um, Hello, everyone. I'm Dr. Farwa Aslam. I hope I'm audible to everyone. If no, please just leave a message in the chat box. Okay, so I hope everyone can hear me, right? Okay, so like I said, I'm Dr. Farwa Aslam. I'm a GMC registered doctor, and today in this webinar, the topic that I have chosen for the webinar is one minute. It's breaking bad news. So we are going to talk about this particular station. Why I chose this topic today for this webinar? Because, when I talk to the students appearing for PLAB-2 exam, I usually, this is my observation that, most of the students find that breaking bad news to be a very challenging station or a case scenario coming in the exam. Why? Because students think it's more about IPS, the interpersonal skills, how you talk to the patient, but it's a little more tricky than that. There and I'll talk how you have to tackle this particular station. Um, okay, so let me just start with a scenario. The kind of scenarios that you see in the exam regarding this breaking bad news. Um, the scenario would be something like you're an FY2 in medical department. Mr. Alex, 65 years, presented with headache. CT showed huge bleed in the brain. He's unconscious but breathing on his own. Neurosurgeon decided active intervention not beneficial. Consultant decided to put him on palliative care. Talk to the wife, address her concerns. So, there is something horribly wrong going on with the patient, and you have to talk to the relative, the wife, it could be the wife, it could be the son, daughter, anyone, any relative, and you have to break the news, tell them about what's going on here. Okay. So any idea how will you start this station? You already have a diagnosis. Okay, there is a bleed in the brain. There's an intracranial bleed. The patient is unconscious, so there is already the diagnosis is already given. So how you are going to start the station? Any ideas? Anyone? You can just drop your insight, your inputs in the chat box. No matter you are right, you're correct, or you're wrong, that doesn't matter. Any ideas if you have, or if you have any questions regarding anything, just drop them in the chat box as well. Okay, well, let me so how you're going to start this particular station. Let me go a step back. In PLAB-2, we all know the basic structure, the three things that we are being marked upon. They are data gathering, history taking, basically. Second is the management, and third is the interpersonal skills. So just always, please keep this in mind, no matter what station it is. Either it's a medical station, a pediatric station, a psychiatric station, ethical station, even if it's a procedure, anything, whenever you enter the cubicle in a PLAB-2 exam, always start with the history. No matter you have the diagnosis, no matter whatever information is given outside, start with the history. Why? Because you have 4 marks. You are going to be marked upon that history and data gathering, no matter what. Now, always data gathering with history doesn't mean you start with, okay, what's the presenting a plane and what's the past medical history. Every station has a different kind of history. And any input about why do you take the history? What's the significance of taking history? Anyone? I have a very silent audience today. Anyways, okay, let me just brief you about that. So history, why do you take history? Like I said, every station has a different kind of history. The main purpose of taking history is to, first of all, gather data. Okay, so in data gathering, obviously, depending on the station, again, like I said, depending on the station, like here you can gather data about what happened, what was he doing before this happened, like there was severe headache, he vomited, whatever, what happened during that incident. Okay, what happened after that, who brought him to the hospital, or was there an ambulance, how did they come to the hospital, anything related to that particular incident that could be in your history. Okay, so first is you gathered data by the history. Second is you ask other questions, through which you get to know about the risk factors. Why the risk factors are important and why the history is important. If you don't ask questions about the history, or you totally, you are like, okay, wow, it's a Breaking Bad news station, I already know the diagnosis, I just go in and I'll tell the, I'll be very nice to the patient, I'll be empathetic, I'll be like, I'm sorry, I'll show some emotions and tell about the news. No, that's not how it's going to work. Because when you're going to sprung that news on the relative, that okay, your patient is going to die, he or she will have a lot of questions, like hundreds of questions, and then you have to give the answers as well. So where does those answers come from? Those answers come from the history, the data that you gathered, like the risk factors. Like for example, you ask, does the patient has any other medical history? Maybe he is hypertensive, maybe there is a family history of such incidents, maybe he is on any blood thinners. So all this information, from where do you get it? You get it from the history. So history is very, very important. Give 2 to 3 minutes to the history. If it's a medical station, definitely you give more time to the history, like maybe 4 or 5 minutes. But in other cases as well, please try to give at least 2 to 3 minutes to the history. Quickly gather some data. And here, the important thing is about past medical history. Maybe anything related. Maybe he or she is on any drugs, any medical disease, any drugs, anything running in the family. Maybe smoking. He's a alcoholic. He's a smoker. Any risk factor that could be related to that particular incident that happened, you'll gather that information from the history. Okay, so first from the history you gather the data, you know what happened. Second is the risk factors so that you can address the concerns of the patient. Then third, talk about the support system. You all know the basic P1, P2, P3 of TOSA. So ask about the support system. Why? I'll tell you why. But now here, let me just tell you what kind of questions do you ask for the support system. Like you can ask, how are you coping with it? Is there anyone with you at the hospital? Who do you live with at home? Anything related to, just to know that, who is going to, be there with the relative or with the patient. Okay. Ask these questions in the history, and I'll tell you why in the history. Just, give me 5 minutes. So in the history, again, just to recap, we started with the, basic data gathering, then, ask about any risk factors, and then the support system. Okay. And support system, we have, multiple questions. You can ask about, obviously, how the relative is doing. That is very, very important question to ask in a Breaking Bad news. Okay, so now you have done the history. After the history, there is another very, very important question that's about ICE. ICE is like it's like the building block, the basic, the basis of PLAB-2 exam. Trust me, when you go in there, you'll realize it's all about ICE. It's all about ICE. You all know ICE stands for um, uh, I for idea, C for your concerns, and E for expectations. Here in this particular Breaking Bad news, the most important thing is idea. You need to ask the patient, okay, has anyone talked to you about this, about the patient's condition? Or do you have any idea about the patient's condition? Or what's your knowledge about the patient? How much do you know about the patient? Why is this question important? let me let me tell you what happened with me in the exam. So you go in there, you have a scenario. I just showed you the scenario. Trust me, when you'll go in the exam, you'll realize that literally all of the scenarios, you know those scenarios. The good part about PLAB exam, PLAB 1 and PLAB 2 is that, PLAB 1, they have a pool from which the exam comes. And again, in the PLAB 2, they have some, 300, 350 scenarios, and the exam is going to be from those scenarios. So when you're standing outside the cubicle and you read the scenario and you're like, oh, bam, I know this station. I took the webinar with Dr. Farwa, and I'm so good with Breaking Bad news, because the same thing I did. I was like, oh, wow, yeah, this is a Breaking Bad news station. I know it very well. So I'm going to know, I know what to do. And I just went in. But what happened was, but now what I was expecting is that, okay, I'll talk to the patient, take the history, and then I'll break the bad news. And then, I'll be empathetic and I'll address the concerns. But what happened was that, when I told him, he was like, yeah, okay, I know that. That's fine. I mean, it felt like, the relative was not at all concerned. He was not sad. He had no expressions, no emotions. So what happened is, sometimes you think it's a Breaking Bad news. I mean, of course it's a Breaking Bad news, but when you go in, the relative or the person sitting inside the cubicle, he or she has a completely different concern. So the whole main idea of PLAB 2 exam is to know what's the concern of the person sitting inside the cubicle, the patient, the relative, and you need to address that concern. If you do everything excellently, accurately, everything, the history, the management, blah, blah, your IPS is 100% good, everything is good, on point, but you fail to address that one particular concern of the patient, you fail the exam. It's that simple. And trust me, if you're not, maybe you're not fluent in English, maybe you missed a few things in the history, a few things in the management, but you managed to address that particular concern of the patient or the person inside the cubicle, then that's all you need to do for on the exam day. So if when I'm asking that, okay, so do you do you have any idea about what's going on with the patient, and the patient says, no doctor, no one has talked to me, I have no idea what's going on. So now you know, okay, the patient has no idea. So I'll start with the regular breaking bad news. What if the patient says, yeah, doctor, someone talked to me, or yeah, I know, my mother had a, yeah, stroke, or my mother had a bleed, or and I know she's dying. Now what? Now you move on to the next step. You're like, okay, yeah, and I'm sorry about that. So what's your biggest concern today? And now the scenario, the station, it will take a turn. It might be a DNAR case. It may be about euthanasia. It could be anything, there could be any concern about or maybe, he's concerned about, okay, I can't get a leave to stay here in the hospital with my mother. Anything. It could be anything, So ICE is very, very important. ICE is where everything will, just open in front of you, and you'll know, okay, which direction you have to go in. So don't forget ICE, please. It's like you just write ICE somewhere on the walls of your room, and make sure you don't forget ICE on the day of your examination. It's that important. And in every particular scenario, ICE is very important. ICE is where you'll know what you have to do. Okay, so coming back to this particular scenario, breaking bad news. Now you talk about, okay, idea. You already know, okay, so this is, okay, the patient doesn't know what to do. Now, I have to break the bad news. This comes now comes the management part. In management here, in the breaking bad news, the main idea is to break the news. So how you're going to break the news? It's not how you say it. Okay, it's not that, okay, some people think that breaking bad news is all about IPS. Maybe I'll say a lot of, I'm sorry, I'll give pauses, and I'll be like, I cannot even imagine what you're going through. Yeah, okay, those phrases, you can definitely use them, but those are very, those phrases are very common. So there should be something that is going to, separate you from everyone else on that exam day. So here's the key, how you're going to break the bad news. Okay, uh, and anyone has any input on this, how you're going to talk to the patient and break the bad news? Okay, well, okay, so what you do in breaking bad news is, you first of all start with giving 2 warning shots. What are the 2 warning shots? Rather than directly telling to the patient that, okay, we check the patient, we assess the patient, and unfortunately, there was a bleed, or there was a stroke, or there was a heart failure, or whatever is going on with the patient, and I'm sorry, your patient cannot make it. No, you start with, building up rapid with the patient, and, slowly and gradually breaking the news to the patient, and building the environment to give the news, to deliver the news. So the warning shots, you start with, first of all, you'll tell them that, okay, well, I'm here to talk about your patient, and unfortunately, I'm very, unfortunately, I don't have very good news for you. So the patient knows, okay, something bad is coming. He or she is prepared. Okay, yeah. So, the first step is, okay, I'm sorry. I'm afraid. I'm very sorry. Unfortunately, I don't have good news for you, or I'm here with the bad news. I'm a bearer of the bad news. Anything. Use your own words. Please use your own words, your own phrase, whatever goes with your own, flow. Just use that. Then give a pause. After that, give another shot. Now you're again, reinforcing that thing that, okay, something bad is going on here. So the second shot, okay, we assess the patient, we examine the patient, we did a CT scan or a chest X-ray, or we just simply assess the patient, and unfortunately, the results are not what we were hoping for. So again, now the patient knows, okay, something really bad is going on here. So, gradually you're building the pressure and the environment to deliver the news. Rather than directly giving the news, you are, building that environment. So a first warning shot, I have a bad news. Second, what did you do? Okay, we did a assessment, we did a test, and the results are not good. Now comes let's go back, to the history. We talked about the support system. Rather than telling them, okay, do you want to call someone? It's very good if you already know the support system. Okay, there was, okay, I know that his wife is sitting in the other room, his son is sitting in the other room, or there's a son waiting at home for the news. So you can always like, would you like me to call your wife in the room before I tell you the news, or do you want to call your son or anyone, whoever is the support system. So it shows that you were actively listening. Okay, and then it shows that you really care. You are really caring for the relative. You are actually empathetic. You actually feel what he must be going through. Okay, rather than asking here about the support, please ask about the support in the history, and then use that support here in the management in breaking the news. So what did we do? Just a recap. First warning shot. Okay, then give a little pause, and depending on the expressions of the patient, you can pause, you can maybe, if he has any query, any question, you can answer that. Then a second warning shot. Then you talk about the support. Can I bring in your wife? Can I bring in your children? Do you want me to call your children? Anything, whatever the support system is. And then you deliver the news. Okay, if he's like, okay, let's call the wife, and now you're like, okay, well, like I told you, unfortunately we did the test and there was a bleed in the brain. So now you have breaking the news. Now you move on to the addressing the concerns. Now, because you have already told the news, now comes the concerns. So many concerns. There'll be so many questions depending on the scenario. Okay, is my patient going to die? Okay, what you're going to do with my patient? What treatment are you going to give? Here, if you're going to talk about the palliative care, then okay, what is palliative care? I don't know what is palliative care. Maybe he or she refuses. Okay, I don't want palliative care for my patient. They could be anything. Now the scenario can again go into a number of directions, but you should know how to tackle those concerns. Always be a safe doctor. In PLAB-2, all they need you to is to be safe, a very, very safe doctor. So always find a middle ground. If he's like, okay, is my patient going to die? Just tell them that, unfortunately, the patient's condition is very critical. It's very serious, but your patient is being treated with one of the best team of doctors here at our hospital. We are trying our best. So let's hope for the best. Let's hope for something good. So you don't tell them that, oh yes, the patient is going to die, but you're not going to give them any false hope that, oh yeah, we will try to save your patient and we are going to save your patient. No, the patient is not going to make it. You cannot save the patient. So tell them the worst reality that, yeah, unfortunately, most of the patients in such conditions, they don't make it. But we are still trying our level best. We are doing what we can do, but we can just hope for the best. That's all. Never give false hope to the patient. Never say anything remotely related to giving any false hope. If and if even then he's like, okay, no, is he going to die? Is he going to die? Then you can like, I'm very sorry, but he might not make it. If it's going in that direction, but you can just at the end, you can definitely tell the patient, but never give any false hope to the patient. So after addressing the concerns in this particular scenario, let's talk about palliative care. So in palliative care, first of all, palliative care, the patient doesn't know what palliative care is. So you have to talk about through the palliative care, what palliative care is. Try to explain that to the patient in most easy words, that what kind of support we are going to provide to your patient. It will be psychological, it will be medical, it will be emotional. We'll try to make your patient as comfortable as possible. Now, for example, the patient is the relatives reluctant, or is like, okay, I don't think so, and I'm not sure about this. Then ask them always. Now comes the refusal. Again, PLAB-2 is about combining all the different structures. Now there is a refusal. You have a refusal structure. Okay, we'll talk about it in another webinar. Refusal structure is Now you'll integrate it in here in breaking bad news. Okay, so why you don't want it? Then tell them, okay, you know what are the if you don't go for the palliative care, what will happen to the patient, or if you go for the palliative care, what will be the advantage of it? You'll threaten them, then you'll give them the benefits, and then ultimately you'll be like, okay, you'll try to convince them if the patient is refusing it. Yeah, but if they're like, okay, yeah, that's fine with it, then you're also good to go. Also, one more thing, when you're telling that, okay, so the a consultant here says the consultant decided to put the patient on palliative care, always try to be use a very mild tone in such scenarios, because obviously the patient is very upset, concerned, a little sad, maybe a little shocked, whatever the emotions he or she might be going through. So rather than telling them that, okay, we made a decision for your patient without asking you, without talking to you, and here it is. No, tell them that, okay, well, so our consultants, the senior doctors, they saw the patient, and they think, just slide in the idea that they think, use the word think rather than, they decided. No, we are not going to decide anything without your presence. So just tell them, okay, we think, the consultants think that, a palliative care might be a very good option for your patient at this particular stage. And then why they think, you'll tell them, and then you'll try to convince the patient about the palliative care. Okay, well, and then palliative care is basically the treatment in this particular scenario. If there's any other scenario, or maybe you're going through a surgery, the patient is going through a surgery, then you talk about the surgery, the risk factors of the surgery, you take the consent for the surgery. Okay, for example, the patient comes with a roadside accident, there is maybe there is a fracture, there's maybe bleed, and the doctors have decided to perform a surgery. So after breaking the bad news towards the management, you'll tell them that, okay, the doctors think that we should perform a surgery which will be beneficial for the patient. For that, I'll need your consent. Okay, and then you talk about the surgery or any questions related to surgery. So but the amazing thing is how you break the bad news. Okay, and I'm sure you all are well versed with how to break the bad news in any scenario. But please always ask idea. Like I said, sometimes the patient is totally literally, they will not give you any expressions. They're like, okay, yeah, we know the bad news, what next? Literally the patient will be like, what next? So that's fine. Don't get nervous, never get nervous in PLAB-2, trust me. But always focus on the person sitting in the cubicle. They will direct you, they will lead you, they will tell you what to do. Okay, that's fine. Okay, you thought it's a breaking bad news, but yeah, the patient wants to know about anything, maybe DNAR. That's fine. Okay, we'll talk about that. No issues, no worries. So, uh, you should have a plan, you should have a structure in your mind, but don't stick to it so firmly that you when you go inside and all you're talking and talking and talking, and you don't bother what the patient wants from you. Please try to listen to the patient, let the patient talk as much as they want, and just try to listen to the patient. In the management, two-way conversation is very, very important. Like I said in the beginning, in PLAB-2, it's very important that even in the management, the biggest problem when I went to for PLAB-2, what happened was I had a structure for everything. Obviously all the scenarios, I have gone through all the scenarios, I know the management, I know the history points. So when I went in there, and every scenario I was like, oh yeah, I need to ask these 10 questions, and I need to tell these 10 things, because that is how we practice. When we practice with our friends, with our peers, that's what we are doing. Take all those, we are like, okay, let's complete these 10 things in history, tell these 10 things in the management, and then, oh yeah, I did it very well. No, that practice, you need to change your practice. In PLAB-2, it's not about telling all the 10 points. It's about telling that one point that the patient needs to hear, and telling it in a way that the patient understands you. Like maybe I have 10 points in the management that, okay, we can do this, we can do this, we can do that, blah, 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 blah. For example, insomnia, I'm just, going off track here. But for example, in insomnia, there's a case of insomnia and the patient, you in the management, you have so many things. You have lifestyle changes, you have medications for that as well. Maybe you can tell about yoga, you can tell about their sleeping routine. There's so many lifestyle changes you can talk about in insomnia. But the patient is not concerned about those things. The patient maybe wants to take sleeping pills. And he's like, okay, I don't care. I just want sleeping pills. So the concern is sleeping pills. You need to know what's your knowledge about sleeping pills, why you want to take sleeping pills. Do you know what are the benefits and what are the harms of sleeping pills, and address that sleeping pills thing. Okay, rather than telling all those 10 points that you have memorized about insomnia, telling them you're like, oh, I did it very well, but you fail to address that concern and you fail to talk about sleeping pills. You fail that station. So in any station, please let the patient talk. Try to figure out what the patient is concerned about. And even if you're short of time, but you manage to address that one concern and tell the treatment, that particular management for that one concern, that, okay, yeah, you can do it. And, make sure that the patient understands. Always keep asking the patient, are you understanding me? Are you following me? Do you have any questions? Just tell him one point, ask him, do you understand me? Do you want me to repeat it? Everything all right? Then go for the second thing. What we do is, I remember when I was doing the practice. So, we were like, oh, wow, okay, 7, 8 minutes, 8 minutes, 8 minutes. And I was quickly going through the management, completing all those 10 steps. And I'm like, yeah, okay, no. That's not how you do it. In the exam, it's all about the patient. Your world revolves around the patient or the relative or the person sitting inside the cubicle. So whatever they tell you, just go with the flow. Okay, and you'll be good to go. So coming back to the breaking bad news, I'll just recap everything once again. And after that, if you have any questions, please just write them in the chat box related to breaking bad news, or maybe anything else as well. I'll be happy to answer them. Or maybe any particular scenario or thing you want us to talk in our next webinar, we can definitely, you can give those ideas in the chat box as well. Okay, so about the breaking bad news again, always start with the history, gather information, talk about the risk factors so that you won't be blank when the patient has concerns after you tell the bad news. Okay, then talk about the support system, then break the news. Always you have first warning shot, second warning shot, and then you talk about the support system, and then you break the news. Okay, and then after breaking the news, the patient, the person, the relative will tell you, okay, now what to do. Maybe they are just so sad and you have to tackle that situation. They are crying or something, or maybe they have questions and you have to address them. Okay, I hope everyone is clear about it. Any questions, any suggestions, any questions, anything? Okay, well, I think everyone is clear with today's topic. Still, if you have any questions about this particular station, Breaking Bad News, or about anything else related to PLAB-2 as well, you can always message us on our website, on our Facebook page, on our WhatsApp groups, anywhere, and we'll be happy to help you about anything related to PLAB-2. Okay, thank you so much. Okay, I have something in the chat box. Okay, thank you so much. Thank you and have a good day. Bye-bye.